Good morning.
Good morning, sir.
So again, myself, Dr. Amit Gohel, I welcome you on the Repertory series, lecture 2. So in last lecture, we have learned what is repertory and the construction of the repertory. Now, I told you that you need to read the repertory, and many of the students says me that, sir, from where we begins and how to. So today's topic is something that we how to study the repertory. So many a time in our practice, what we do, we just understand the patient's the language of the patients, and after that the language of the patient we search certain keywords, and that keywords we can search in the repertory. Nowadays the computer repertory is there. So this keyword has to be searched, and then we correlate the patient's behavior with that keywords and a certain rubric we can find. So that was one aspect of understanding of repertory. But it is the process is something which we call as haphazard. So there is no head and tail in that keywords and everything. We may find many rubrics, and then we'll end up with the confusion that which rubric has to be picked up. So today we are going to study how the repertory to be read and how we can use repertory, the beautiful use of repertory in our practice. So let's see. So first and foremost thing, in last lecture also I said what is the need to study the repertory. So if we understood the why, if we have a clarity of the mind that why we need to study the repertory, then and then we can read that subject in a proper sense. So first and foremost need to study is to solve the cases. So many a time we used to take the whole case, and after whole case we extract some totality, and from that totality we have to find some SSPU into the case, and then we have to repertorize. Or sometimes we may find a lot of general symptoms in the case, and then we took certain general symptoms, and then we add some dispositions, and then we have to rule out a repertory. So this is the tool which is useful to solve the cases. In olden practitioners, they used to prescribe on the basis of keynotes. They used to prescribe on the basis of some of the observation symptoms. They used to prescribe on the basis of they have a three-legged stool. So, and they have a sphere of actions, the pathology. So many olden prescribers is using repertory by heart. But nowadays, in our days of era, we have to use in a very precise manner, and that is the why we learn repertory to solve our cases. The second use of or need of the study of the repertory is to apply the study of materia medica. So many a time we read Allen's keynote, we read Boger, we read in our college day I used to read the Dubé, S.K. Dubé. He is a very good author, S.K. Dubé, and he has compiled a remedy in a very short format. But still, in a repertory we may find lot of different rubrics and different aspects of the materia medica. So to understand a particular materia medica, we need to study the repertory. So because when we learn certain remedy, we may fix our idea to a certain border or boundary of that picture of that remedy, and we cannot accept the outside boundary picture of that particular drug. So by learning the repertory, we can understand that this constitution is like to be like this also. Okay. So for example, last time I had given you the example of pulsatilla. So we understand the pulsatilla as a very mild, yielding, timid, weeping, tearful disposition. But when this pulsatilla having a certain situations which she has to face, and she develop a courage, and they goes into a state of psychotic miasm, and they become courageous, business minded, very manipulative, very deceitful, very selfish kind of personality. So this is a different aspect of pulsatilla. But when we learn this repertory, then and then we can understand this pulsatilla can be like this in psychotic miasm, In a story miasm, they can be very mild, yielding, and this. So this is very important to study the repertory. Second, better and interesting way of studying remedies, either in a single or in a group. So same example apply to this also. So this is what we have to need to study this repertory. Now the question still arises, how? So how do we do this? Many a time you all ask me the question, sir, कहाँ से शुरू करें? Then I said that read the rubrics. So well, here is how. So pick up the repertory, read different rubrics. So reading is must. When you read something, you can instill that information into your brain. And when there is information is instilled in your brain, it can retract at any time. Now, then what you find? When you read something, what do you find? You find some rubrics. That's it. Okay. So from absent-minded, abrupt, abstraction of mind, and everything, you can start from the first mind chapter. Okay. Or in generality, you can start with the abscess and all the pathological rubric. So the confusion lies again. Sir, rubric. So how can we understand? Many a time, very difficult aspect of understanding the mind chapter is the problem with the language barrier. One thing. Second is we have to improve our vocabulary. If we improve our vocabulary into the English language, then and then we can understand the language of the patient with the rubric which have given into the repertory. So this is what we have to. Then you find some rubric. That's it. Then again, look again, and you will find that. What you will find? This rubric suggests something. So there are some rubric which suggest something. What it is? Tell me. What rubric can suggest? You have read some rubric, then you understand that. Look again that rubric. You understand, yes, this rubric tells something. What that rubric tells us? So for example, absent-minded. What that rubric tells us? We read absent-minded. Now what is the meaning of the mind is absent? Means the person is not present in that moment, their mind is absent. So he is either not concentrating on something or he is not working in a proper way. That was the just simple meaning. But what that suggests? This absent-minded symptoms is suggesting what?
Particular state of person.
Yes, particular state of person. So what you will find? You will find that this rubric is belong to certain aspect. That what is the absent-minded belongs to? Say we have to understand the man in disease. When we have to understand man in disease, we have to bifurcate man in a different categories. Let's say we have learned the dispositions in the last year. That in the last year I had said that disposition are of three types. One is a mental disposition, second one is a physical disposition, third one is a general disposition. So what could be the mental dispositions? How we can understand man as mental disposition? So the man can be either extroverted, either introverted. There is a will, there is an intellect, there is a moral, there is a attachment, there is a sensitivity, and there is a emotions and everything. So you will find in the rubric that this rubric is belong to certain categories. Are you getting me? So you will find what? Some rubrics are expressive, some rubrics are non-expressive. Say for example, person does not wish to talk or does not wish to communicate. So this is a non-expressive kind of rubric. Whereas person comes to you and they start a conversation with all of you. So we can think that this is extroverted kind of personality. So this is what you have to find when you read repertory from the rubric. You will have to categorize that this rubric belongs to which group. So either an expressive group of that rubric or it is an inexpressive group of that rubric. One thing. Second, the rubric is either objective or a subjective. We will go in the detail. I will just narrate the corollaries and then we will go into the details of that process. Okay. So what is the certain rubrics are objective? So objective means we have to observe something, and certain rubrics are subjective. That means we have to rely on the patient's feelings and patient's sufferings. So that is a subjective one. Okay. The third one is either certain rubrics are an intellectual one. Say for example, the person says that they used to having a quick response in everything. So we have a quick brain remedy. Okay. So we can understand this is an intellectual kind of personality. Okay. Some cannot calculate certain things. So we can think that the intellect is not working in a proper sense. Or emotional rubric. So emotional rubric, you always say that they are very sentimental kind of personality. They can be very emotional, or they can be hurt by a very trifling ailments. So this is a vulnerability emotional. So this can be, you have to categorize. So when you read rubric, then you have to rethink what rubric this belongs to. Then again you have to rethink what rubric is suggestive of. So then your depth of understanding of the repertory and the rubrics is very vast. Okay, so you can get this. So sometimes you can find causative rubric. So most of in a mind chapter we have ailment forms, or some rubric is given as from. So from means that was the things that affect that personality. Okay, and that is what we have to understand. This is the causative kind of rubric, and some are resultant effect. So there is a disappointment in love. This is the causative rubric, unhappy, sad things, and the person is constantly thinking over this event throughout their years of life. So there is a resultant rubric or resultant effect, that is either they go into brooding, a state of, or they dwells on the past disagreeable event that occurs in their life. So this is what certain we have to understand. This is some positive and this is some resultant effect. So we may have to categorize, and then our understanding of repertory is very important. Okay. So some are a disease rubric and some are a non-disease rubric. So sir always used to say that when you find a non-disease rubric, it is a very important in the case taking, because it cannot change and it is the expressions of the genetic individuality. So that is what we have to focus on, this non-disease characteristic. And some are the obvious rubrics and some are the concealed rubric. So what could be the obvious? Obvious can be everyone can seize, everyone can perceive, or everyone can understand. That is the obvious one. And concealed, that is called as a private self. The person is not allowing themselves to express, and that things to be in the privacy. So most of the sexual histories are concealed. You know, most of the time the persons never told you. In the 4, 5, 6 visit, you are prescribing a lot of medicine, you are not getting result, and finally you will end up that the person is very kind of extramarital affairs and everything. So the moral is not good. But in an initial you say that the moral is very good. So this moral bad is something called as a concealed rubric. So it cannot be revealed. It can be revealed by someone else, or sometimes they are secret wise. That's why that can be concealed. Say for example, hypocrisy. You know, in a hypocrisy, what we have seen the Ashram 1 and Ashram 2 series. In that we have to understand the characters. It is just for the understanding that the character of that guru is a hypocritical. Actually, it is not a guru, but they are showing to the society that they are giving blessings and everything. But the sora behind that, so this is a concealed rubric. So from that you can understand that it is a kind of the concealed. So we go into details of each and every component. So expressive versus non-expressive rubric. So some rubrics are very expressive, some rubrics are non-expressive. Now what is the expressive rubric? So this covers those rubrics which represent expressive symptoms in the repertory and will be helpful in the tackling and expressive the patient. So most of the expressive patient will tell you this kind of rubric. So for example, the person is very laughable, joyable, enjoyable and vivacious kind of cheerful kind of personality. Sometimes the person comes to you, before asking any question, he starts narrating every symptoms. And you are not allowed to talk any words. So this is something which we call as the loquacious kind of personality. Sometimes some constitutions, or you may say the child comes to your clinic and they started shouting, shrieking. So this shows that this is the expression. So this is the expressive kind of the symptom. Some may goes into developing the pity on the self and they started lamenting to you, yes sir, I have this complaint and this is pain and that. These are the lament kind of the situation. So these are the expressions also you can see on the face. Expression you can see in the gestures. Expression you can see in the act. So these are the expressive kind of rubric. Okay. There are many, but these are the few examples which I am elaborating. But when we read repertory, then we can understand all gestures are expressive kind of personality, expressive rubrics. All gestures. So there is a frowning. You can say there is a face which is very anxious. So face expression anxious. So face which is astonished. Face which is shocked. So these are the expressive kind of rubric you can think of. While non-expressive rubrics, so those rubrics which represent those persons or patients who either don't talk or communicate very little. You know? They just give you this complaint. I had this complaint. Okay, fine. Anything else? No sir. Anything else? No sir. Anything else? No sir. So either they nod, either they say no's, or these are the non-communicative kind of personality. They are non-expressive. So from that non-expressive we can have to infer that what kind of the disposition he is. So either he may be reserved kind of personality, either he don't want to talk, either there is a grief which he don't want to show to us. You can either find in the eyes of the person that he may be sad because of certain event, but they are not going to tell you, or they are not wanting to demonstrate you that I may have a grief, but you can perceive the feelings of that things, and that is a grief undemonstrated. Okay, so sometimes they have anger, tremendous anger. See, I had seen a lot of ladies who used to cry, but when they cry, their eye becomes so red. What is that representation? So that redness of eye suggests that there is a lot of tremendous anger, but she could not express that anger, and she could express when they are weeping. Okay, so this is something that they are anger suppressed. Or some may goes into the constitutions of disposition that I don't want to talk to anyone. Why disposition? Either you ask anything or not. So we have certain from talk industry. So we have in acute change disposition is anger when obliged to answer. When we asking something or when we questioning something, we don't want to give any answers and he got angry. So this is a very particular disposition you have to understand, because it is a non-expressive kind of symptom. So you have to judge from the expressions or the behavior of the person that he don't want to talk with us. So this is one aspect, expressive versus non-expressive. There are objective versus subjective. Now what is that things? Some rubrics are very objective, so you can observe that things, and some rubrics are very subjective. So objective is those which can be seen, first thing, which can be seen, which can be touched, which can be felt with our senses. So these are called as objective rubrics. Okay, these are definite and cannot be denied. So when you find this objective rubric, it cannot be ruled out. It can be the entry point in your case. You know, so there is a hardness, there is a frown, there is a restlessness at the physical level, there is a swelling, and there is a discoloration. When you find that these are the physical as well as the psychological rubric, which is very obvious and objective, then you can take it into consideration. You know, frown disposed to. We have a 16-17 remedies in our Materia Medica. So many people comes to you, they don't have a frown. Few constitutions has the frown. So this is a very important rubric in our case taking as a disposition. So you can understand from the frown that either the persons are very angry, either the persons are very focused, or either the persons are very concentrating on certain some symptoms. So Naxomica can be frown disposition, Lycopodium can be frown disposition. So dominating dictatorial kind of personality having a frown disposition. So from that you can infer dispositions. Okay. So it is very important. Again, the hardness. So hardness can be physical as well as a mental. Okay. So in the physical aspect, you can feel that hardness in the particulars. Either may have the eruptions, either you palpate the abdomen and you find some hardness. So hardness can be stony, hardness can be pliable. So this is something you have to understand. Or some tumors. The tumors can be very hard, tumors can be very soft or spongy. So this is leading to objective symptoms. Okay. Well, what is the subjective symptom? The symptoms which patients experience, but you cannot see it, you cannot measure it, or you cannot sense it. Okay. So say for example, patient says I have a lot of pain in abdomen. Now you cannot measure what kind of pain is it. He said lot of pain. You either categorize as a mild, moderate to severe and the severe categories of the pain, but you cannot measure that. So this is something that the pain the person is telling you. Sometimes the person is telling you that I had a burning. So this is a subjective one. Very important. Okay. Sometimes patient cannot tell any particular sense of the sensation, but they say there is a pain. I don't understand what type of pain it is, but it is a pain. So this is subjective. The grief as a mental level, you cannot measure what kind of grief he is gone through. Okay. The indignations. The indignation means the righteous anger. You cannot measure that, but the person's expression tells you. The dim vision. The person says, I don't see in a proper way. I may have a spectacles, and it was increasing myopia or increasing astigmatism or any refractory error in the eyes. So this dim vision you cannot measure. You can measure by the eye checkup, but you cannot. These are the subjective symptoms. Sometimes patient says, sir, when I used to get the headache, I used to have a blurring of vision. So it is the symptoms of classical migraine. But this is the subjective feelings. Okay. There are a certain perception which we call as the delusions. So it are the subjective ones. So most of the time we have to infer the behavior of the patient, and out of that behavior we have to understand what he is going to have, the false perception. So this is what very important subjective symptoms. The sensitivity is very subjective. Some are sensitive to rudeness, some are sensitive to criticism, some are sensitive to insult, some are sensitive to punishment. So these are the certain individuals which are sensitive. Some may are sensitive to rudeness but not sensitive to criticism. Okay. Or some may sensitive to criticism but not sensitive to rudeness. So that should be the very subjective one. There are dreams. The person's experience of the dreams is very subjective because it is a subconscious phenomenon. The cravings and aversions, it is always subjective. In that, aversion is very important rather than the craving. Okay. So the third category is intellectual versus emotional. So some rubric will reflect the intellect. I say you earlier that the person is absent-minded. So again, absent-minded is a kind of intellectual rubric. It is not an emotional rubric. You know. So same way we have to understand. So those rubric which tells us about the thinking capacity, thought process, intelligence are intellectual one. Either a memory or the intellectual rubrics. So the memory got impaired. The person says that I cannot remember the street where I have gone, or I cannot remember the things which I have to do right now. Or sometimes the lady tell you that I used to go to open the fridge and suddenly I forgot that what should I have to take from the fridge. So that is happening. It is happening. It is a kind of intellectual So we have to categorize. It is a forgetfulness or a memory, weakness of what about to do. So these are the few rubrics. So in that intellectual, so conscience, what is the conscientiousness? The conscientiousness means the sense of right and wrong. So when there is an intellect is working properly, then they can understand this is right or wrong. If it is intellect is not working, then it is conscientiousness gone. You know? So in most of cancer cases, there is no conscientiousness. But in a soric psychotic cases or sauropsychotic, you can find conscientiousness. That is what very important. The positivity, the intellectual rubric means what? I can relate these things and I can positively believe in that things, or I can positively handle the situation. This is what I have to use a thinking process. I have to use my reasoning. I have to use my logic, and that is what the positivity is. So these are the positive aspect of the intellect, whereas these are the negative aspect of intellect. That person may goes into idiocies, person may goes into imbecilities, or sometimes person cannot concentrate on a particular subject. Most of the time the children, mother used to complain that sir, ये बच्चा पढ़ता नहीं है, and you ask what happened. So थोड़ा पढ़ता है, फिर उसका दिमाग है ना टीवी में चला जाता है, उसका दिमाग उसमें चला जाता है, कार्टून देखने लगता है, मोबाइल देखने लगता है. Then this child is not going to concentrate on particular things. So this is what concentration difficult. It is an intellectual one. Versus we have a certain rubrics which is emotional kind of. So what is the emotional? The symptoms which tells us about the sentimentality, feelings of the person. You know? So this is what the persons are very sentimental. The persons are emotionally vulnerable. The persons showing you a grief. Persons want sympathy or giving sympathy to others, or either a person felt the same suffering of the others, like Lysinum. You know, sympathy others for. And a person shows the affections, so affectionate, kisses and embracing others and everyone. So most of the children came to the clinic and they tried to hug the doctors, or they tried to show the love to the doctors, they tried to show affection to the mothers and fathers. These are the phosphorus kind of personality. So in that we have to understand this is the emotional remedies more. Okay. So from rubric also we can understand what emotions are there. So in the last Thursday sessions of germanium mat, we have understood the germanium mat affected mostly on the intellectual aspect, not on the emotional. So the intellect is compromised. So same way from this repertory you can understand which remedy has compromised which kind of. Say for example alumina, intellect has compromised. Germanium, intellect has compromised. Whereas natrum mule, emotion has compromised. You know, are you getting me? So this is very important to understand that the reaction is become either emotional or intellectual. See, if the person is not understanding what is the gravity of the situation and he do the things which is not proper to that gravity of situation, then we can understand that the intellect is not working properly. And we can take directly, Sir has used to prescribe, Sir has said in the Baraita, lot of this kind of symptoms as a misplaced symptoms. So in misplaced, the intellect is misplaced. That he cannot understand the gravity of situation. We can take the rubric indiscretions. Are you getting me? So this is something emotional, this is intellectual. Now, very important aspect is the cause versus effect. So some rubric tells you a cause, or some rubric tells you a resultant effect which they suffer from. So the positive factor, the factor which lead to the series of reaction. See, the things or circumstances or a factor which is happening in the life of the person, and after that incidents or after the circumstances, the person goes into series of reactions, and that reactions, the person's psyche, it can be in the person's psyche or in the physics. If we can get the definite positive factor, then it is assume a lot of significance. So most of the time, what Hahnemann has mentioned in the aphorism number 5, that the exciting cause in the acutes and the fundamental cause in the chronic. So he always emphasizes on the causative aspect, that the cause is very important and lot of significance it has. So that we have to find out this factor. So most of the time in the acute we can find out that ailment from admonitions, or the sensitive to kindly admonitions. You know, even a kind word affect her that they are going to affect me. The platina is one of the remedy. in a spheric state. Ailment from anger suppress, ailment from the grief, or either in the physical form it is the ailment from vaccination. So these are the things which is very very causative in nature, and after that the lot of reactions is happening. So recently I got a boy who came to me with the fever, and that fever was body ache, fever, malaise. So I asked what happened. So he says I want to go to abroad. So I used to take vaccinations, a booster dose, and the day before he has taken a booster dose, and the next day he got fever. So the rubric which we have is fever, vaccination, after. The only remedy came to my mind is puja. I prescribed puja. So this is what ailment, positive. And after that, consequence reactions is either physics, person science or the person's physics. So in the physics it is a fever, then we can think of that. If it is something different, then we can think of different remedy. So what are the resultant effect? So these are the rubric consequences of the causative factors. So resultant effect are the consequences of the causative factor. This depend upon the sensitivity of the individual and affect those part of the body which are weak or prone to the affection. This tells us the sphere of action and the person's both mental and physical form. Now, if the person is susceptible to affected by the either a grief, either a anger, then they are prone to affected. Aphorism number 31. What is the aphorism number 31 says? The inimical force which is partly psychical or partly physical, which directly influence on the human being, it produces morbid phenomena unless and until the person is sensitive to that or disposed to that. If it is not disposed to, then this cause is not affecting the same. Are you getting me? So same way the resultant effect is based on the causative factors. So most of time we have the certain, see here the admonition, but what was the things after admonition? The person goes into state of weeping. So weeping is a resultant effect after the admonition. So we have to understand that rubric in a proper sense. So we have to correlate the cause and effect. When you correlate the cause and effect, the repertory becomes very easy to understand. Let's see in our these lectures, the certain are sensitive to criticism. So after criticism, they goes into a state of certain disease. So these are the resultant effect. Grief cannot. Most of the people who cannot show their grief or their sadness, and they say that after that incident I cannot cry. Or some lady may say that my tears have dried up. So I had a lot of struggle in my earlier life, and then I developed myself to such a state that my tears are dried up. So this suggests that they have a grief, but they cannot weep. And mostly this is something that this can produce a diabetes. This can produce a diabetes because it has to be ventilated. Mostly in the female, the conflict of diabetes is fear and disgust. Fear and disgust, mostly in the female cases, not in the male. In the male it is a resistant conflict, but in the female it is a fear and disgust conflict. So in that they have to adapt a certain situation and they become very hard and tough to fight. Diabetes means to fight. So in that case, they have a grief, they are sensitive, but they cannot weep. They don't show their feminine quality of the weakness and femininity, and they become hard. And that is what they have to fight, and that is what the glucose is increasing. So this is the symptoms of diabetes. Most of the time, my sir, Dr. Suketu, tell us that Netramule is one of the best remedy in diabetes. This is what his clinical experience. I have prescribed in a few cases and I got a wonderful result with that. So this is what from the experience I am telling you that this rubric is very important when you find a diabetic patient and patient says there is a bitterness. But that bitterness is expressed as we cannot or as a grief, and that is what producing a diabetes. Another is resultant effect is the person. Most of time a children comes to you, a very young children comes to you after a measles or rubella vaccines or some vaccination. They may end up with the fever, and the fever goes very high, and finally they'll end up with the convulsions. So patient says that 3, 4, 5 days we have given vaccinations and suddenly he got the fever and the fever rises. So it may be febrile convulsion, but this is what something that convulsion happened after certain protein imbalance, which is mostly produced by the vaccination. So this is what the resultant effect. So we have a certain rubric with the resultant effect. Okay. Now we have to understand very important aspect of understanding this is very important in the whole history, because this is very important to understand the disposition of the patient and which is genetic in their nature. So there are disease symptoms and there are non-disease symptoms. So some symptoms represent disease, whereas some symptoms represent non-disease, which we call as a natural trait. So natural trait means what? They have adapted or they have engrafted from the ancestor into their genes, and that is the expressions. So that is a natural by birth. Okay, and it is non-disease. So what is that disease symptom? The symptoms which resulting out of some disease or a pathology or affection, and these are helpful in the diagnosis of the case. Most of the time a disease symptoms helpful in the diagnosis of the case, but from homeopathic prescription point of view it has lesser value. But from homeopathic point of view, what was the importance of the disease is we have to understand disease in terms of miasm. If we understand disease in terms of miasm, then we can understand what approach we should go with this case. If it is a psoric disease, then we have to find out certain causative factors which produce this psora, or this is the psora is there and there is a latent outburst of the psora because of some causative factor. So you have to find out that. Whereas some pathology or disease suggestive of some psychotic or a tumor or a growth or an induration. So in that case we have to find out that this is something happening because of psychotic miasm. And why this psychotic miasm happening? Because it is developed from the psora. So we have to find out what was the things going to develop this. So it may be either insecurity, it may be either a protection, or it may be a lot of fear or anything. So these disease symptoms is helping us to understand the miasmatic process, not a totalitical or not a entry point in the certain cases. Okay, fine. But we have to understand the disease process as a miasm as well as a pathological process. So many a time we took the certain rubric from the generality chapters. Say for example, the persons having a degenerative knee joint affections. Okay, so we can directly take that there is a cartilage affections in generals. That means the cartilage is affecting. So same way we can take a certain rubrics. So that is helping you to understand that those remedies which have to be given or prescribed, it has affinity to deal with that disease. So that is what we have to enter the case as a last in the diagnostic things or a disease symptom in the totality last. Whereas non-disease state, so what was the non-disease state? The non-disease state are something that it is a natural attribute of the person arising out of his genetic makeup. So what is the genetic makeup? Genetic makeup represents some expressive symptoms, some non-expressive symptoms, some of the postures, attitudes, behaviors. So these are non-disease kind of trait. So what was the what we think of that these are the very tremendous and significant importance in homeopathic case taking. Why? Because when you understand this, you can understand the patient as a whole. What was the law of homeopathy? The law of homeopathy is treat the man in disease, not the disease in man. So when you understand non-disease trait, we can understand man in disease, or we can understand the man or a sickness. So that is what something that is the non-disease character. It can be either a mental, it can be the physical. So in the physical form we can say this child is very lean thin. In the whole family, this is the only lean people. So this is what their characteristic is. Okay. So lean people, some children are very tall. So we have a Dr. Anish, very high, 6.5. So this is what tall. So this is a non-disease characteristic. So from that you can enter through the case. So we have a phosphorus, we have a creosote, we have a tuberculinum, we have a calcarea phos, we have a calcarea carb. These are growing too long, bone growth too long. So this is what they are, tall people. So this is a genetical non-disease characteristic. Okay. Some have a mental, say they are very courageous by birth also, or some are the melancholic type of personality. They are pessimistic in every situation. So these are the non-disease characteristics. They can take everything in the bad part. Okay. So they are pessimistic. Some are audacious. So this is a non-disease characteristic, and these are the few examples. We have a lot of in this non-disease characteristic. We have in the next lecture or in the series, we will categorize certain rubrics. These are the rubrics of the will. These are the rubrics of the intellect. These are the rubrics of the emotion. These are the rubrics of the moral. So we go by go flow. So this is what I am compiling the process that you can very easily understand the repertory. Okay. So very important, stoop shoulder. So most of adult comes to you with this type of stoop shoulder, and you can enter through. There are 26, 27 remedy. We remember only one remedy, sulfur. But there are 26, 27 remedy in the stoop shoulder. So you can enter through these rubrics and prescribe. You will get a wonderful result, because these are the genetic non-disease characteristics. Are you getting me? So last but not least, it is certain rubrics are the obvious and certain rubrics are concealed. I already mentioned you the things. Obvious are these are the similar to the objective rubrics. You can observe it and mention about. These are the features which cannot be argued, as everyone is able to see them clearly. Hence, have to be given a lot of value and should be used as an eliminative rubric. So when you see something, you are confirming that, and you cannot eliminate it. Oh, or you cannot deny from this. So this is what we have to understand. So we have one patient came to us always with very trendy clothings, and every time she used to come, she had a lot of trendy clothing. I had never seen her in almost 20-25 of follow-up the same clothes she wear and came to my clinic. Every time she used to come with the trendy clothing. So this is something called as a foppish. You cannot neglect it. You know, very important. Cleanliness. So most of people, when you ask about the cleanliness, so the relatives or someone accompanied them, they will tell you, sir, दिमाग बहुत खराब है, कुछ भी गंदा हुआ इसकी हट जाती है. That is what they are more towards the cleanliness. Loquacity, as usual, we are very obvious that the person is very talkative, and the person is too much talkative, and person says that, sir, I don't talk much. This is something we have to understand. This is a loquacity. So some are very hurry and haste. So they came to the clinic and, sir, kitni देर लगेगी? Sir, kitni देर लगेगी? Within 5-10 minutes, he call you out of time. So this is something called hurry, haste, and impatience. They cannot wait for that turn also. So this is very, very obvious, and you cannot neglect it. You know. So you have to be your antenna open. Sir always says you can open your antenna so you can pick up that things very easily. Sir used to take this, very important. And the patient came, sir, abhi ka abhi ठीक कर दो मेरे को. The rubric is impatience cure at once. The remedy is chamomilla. So simple things you have to understand from this obvious symptom. Whereas concealed symptoms, so these are the symptoms which tells us the skill of the homeopath in case taking. To get these symptoms out of an individual require a lot of patience or art. You know, you cannot get these symptoms in a very initial statement or initial history. Sometime after 1 year of the whole history, and you are prescribing a lot of medicine to patient cannot get betterment. Again they come to you, and then finally you landed with the certain rubric that this is something that they are manipulative, very, very manipulative to you. So deceitful, sly, liar. These are the rubric which is concealed, and you cannot find it out. So they tell you very good things on the face of you, but at home they are very, very cunning, liar, and this. So you have to be open your antenna, and you have to understand what is concealed behind that, and that should be very important. So this is very important, and these are those qualities of the person which tries to cover or justify. So those who shows I am a very good, there is also bad part in that. So you have to understand the private self. The public self is different, whereas the private self is different. So you have to understand what was the private self of that person. And then you can think. So in private self, these are the symptoms you can find. You know, what is hypocrisy? One thing is hypocrisy in a homeopathic world. I am not criticizing any homeopath, but this is what just for understanding that the person is showing a lot of things in the online background that I have done this, I have done this, I have done, and when you go to the clinic, you cannot find anything out of it. This is something called as hypocrisy. Are you getting me? So hypocrisy you can find anywhere in the things because it is a public self. So what was the practical aspect of repertory? Now we have just categorized something that these are the concealed symptoms, these are the obvious symptoms, these are the objective, these are the subjective, these are the expressive, these are the non-expressive, intellectual, emotional. So what was the practical aspect of repertory? Let's have some example. So person comes for the first time, and as the case taking progress, they get frustrated to find out that he just answered the question to the point and nothing more, nothing less. Now what was the homeopath think of in this situation? Yes, aorta. Anything else? Answer abruptly. Yes. Anything else?
Indisposed.
Anything else? See, same thing happened with this. What we do? One homeopath says he is reserved, he don't want to tell something. Another homeopath says he is non-communicative, maybe highness. Another homeopath says, oh, he is very egoistic and haughty, so don't want to answer the question. And we landed with these possibilities and probabilities. Are you getting me? So, another things. Let's have another example. Then we will go through the certain practical point of view. What was the important things in the repertory? So one person tells that she cannot tolerate her husband scolding her. She gets very upset and that affects her. Now what was the possibilities? She cannot tolerate her husband scolding her. She gets very upset and that affects her much. Huh? Admonitions. Okay, very good. Then anything else? You know, she cannot tolerate her husband scolding her and she gets upset and that affects her. Ailment from scolding. Yes. Anything else? She said admonitions, you said scolding. Then sensitive to criticism, sensitive to rudeness. Anything else? Anything you can think of? You know? Anything you can think of. So, let's say, what we do? One homeopath, same, like admonition aggravates. You are the great one, first one. The second one, sensitive to reprimand, criticism. You are the second one, offended easily. The third homeopath, injustice cannot tolerate or either defined. So, but still we are in a confusion and dilemma of what rubric should be taken into the case. You know. Now what was the rule? So we end up with the confusion and debate who is right and who is wrong. Most of the time in the repertory it happens. Always it happens. And that is going to. So here I am to tell you something that how to overcome these situations. Why I have given these two examples? Because out of this example we have a food for thoughts that we are thinking something. And when we are thinking something, we have to correlate something. So what we have, what sir says that something which we have, which are there installed in your mind, it can come out only. So something that you have, it can come out. But something which is not there, it cannot. So let's see. So extraordinary people don't do different things or extraordinary things. They just do things differently. This is one of the proverbs. Okay. So what Dr. Prabhu Vijayakar told us that don't take anything out of it. You take just the general things, that very simple rubric that no one can deny. See, no one can deny or no one can rule out. The first case was that talk indisposed. I don't want to talk. The talk is indisposed. It's a broad rubric, but no one can deny it. Because you either take a reserve. So मुझे reserve नहीं लग रहा है. मुझे तो secretive लग रहा है. That means you are different than that. So same way, the person does not wish to talk. Sometimes we can take answer version 2, answer frivolously, closing the eyes like sepia. So these are the few rubrics of sub-rubric of that thing, but we have to just understand in that talking. So what was the rule? Rule in the repertorizations. The first lesson from that rule is to prescribe rightly and avoiding the guesswork. You know what we are doing? The guesswork. This can be the possibility, this can be this can be this. So these are the guesswork. To prescribe rightly and avoiding the guesswork, the first thing is take a large rubric, which is a big, solid, and which everyone has to agree on. Are you getting me? Very important and simple rule. For example, it should be an objective rubric. So talk indisposed to everyone can see that this person does not wish to talk. Yes, checking चल रहा है. अभी थोड़ा बहुत पूछा पर उसको फ्रस्ट्रेशन आ गया. इतना सारा क्या पूछते हो सर? इतना सारा क्या करना है आपको? मेरे को जल्दी है, मेरे को जाना है, वो है, ये है. I don't want to. सर दवाई दे दो please. So this can be objective one and not the subjective rubric. So most of the time I used to take very important restlessness. You know, if we have a case of zincumbent, I have the person came to me and I asked, what is the complaint? क्या complaint है मुझे? And he repeat the same. The uncle came to him, and in that case he has constant restlessness of the leg. So I prescribe zincumbent by 2 rubric. Repeat the question before answering and the restlessness you know. So restlessness is a non-disease, or restlessness is very a bigger rubric, and the objective rubric which no one can deny. Are you getting me? So this is something talk indisposed to restlessness. So first lesson to be learned is you can take a bigger rubric, so your remedy cannot be ruled out. You know, many a time when we advance our learning, then we can narrow down it. So what was the Kant's repertory teaches that you have to understand first general, from general to the particular. Okay, and then we go from particular to the general. So this is what our understanding is. We have to understand the Kantian way that it is a general. So this is what general criteria has to be fixed. So the first lesson is this. Now what is the next step? See, why I am giving you the step-by-step process, that it will help you to understand how to prescribe for the man, not for the disease. Okay. So next step. So we proceed by taking the quality of the person which runs through and through his personality in a various situations or circumstances, either in the childhood, youth, or adulthood. Again, bearing in mind that they have to be solid and beyond doubt. You know, बचपन में भी ऐसा था, शर्म आती है, कहीं जाता नहीं है, अभी भी शर्म आती है. सर ऐसा नहीं है, ऑफिस में बोलते हैं पर उतना वो क्या, मुझे थोड़ा हेजिटेट होता है. मैं ऐसा सब जैसे वो प्रेजेंटेशन देते हैं ना, वैसा मैं प्रेजेंटेशन नहीं देता हूँ, ऐसा नहीं है, देता हूँ, बट स्टिल इनसाइड मी समथिंग इज गिविंग मी अ बैक, एंड दैट इज व्हाट शाइनेस. सो दैट शाइनेस इज अ इनर कैरेक्टरिस्टिक. So you have to take from the childhood, youth or adulthood, and that is the very beyond doubt. Okay. So those quality of the person which are unshakable, you cannot shake it. Okay. Or which describe him as a person, this is called as innate characteristic or the trait. Very important. So first step is you have to take the larger rubrics. Second step, you have to enter the innate characteristic. So persons remain very positive in a lot of negative situations. The test of positivity is happen when the situation become negative, unless and until. If the situation remain positive, the person can be remain positive. No need of that things. You have to understand that thing. So if the situation becomes so negative and he become positive or she become positive out of that, or that is something that their innate characteristic is suggestive of. So most of time the test of conscience happen where? When they have to take a decision right or wrong. Unless and until if the situation is in a proper way, the conscience cannot be tested. If the situation is happening and then the conscience is tested. So that is very important. The mildness, if the person has to be angry, but he remains very calm, cool and mild, then it is a mildness. Very important aspect of understanding of these things, innate characteristic is he remains so mild even though the situation is worse. Then it is very important. The positiveness, as I said, that exuberance, so much so excited, so much so laughable, enjoyable, vivacious, exuberant kind of personality, in spite of gravity of the situation. There may be a possibility that he may want to escape the situation. Most of drug remedy goes into this state because they don't want to face the gravity of the situation. So they go into the state of exaltation and exuberance. So most of drug remedy goes into, but this is something called as, no one can go into this state. The drug remedy can go into this state only. So that is very important because it is innate characteristic or trait. So courageous, covetousness, unfeeling, hard-hearted, these are the few innate characteristics has to be considered. So why this is more important, given so much, why we have to give so much value to this? See, anything has to be a reason. Why this has to be given more value? Reason is that the character which determines the genetic makeup of that individual. Are you getting me? So this is something that this is non-disease, this is their genetic makeup and this is their trait runs through and through in their life since childhood. So this is called genetic dispositions. And most of the psychotic or psychosyphilitic disorders, in that case you need this. In acute you need change dispositions. The disposition which change after a disease or after an ailment, you need that. But when you treat a psychotic or a syphilitic or psychosyphilitic disorders, you need this innate characteristic, very important. So now, how do genes determine the nature of the person? The question arises in always our mind. How? So fact is the gene is responsible nearly all what we see as an individual. The genetic makeup of the person remains same throughout his life, first and foremost thing. Genetic never change. But the circumstances which makes the gene to express certain genes to be expressive, certain genes become repressive. And that is what the person's adaptation and that is change. But genetic makeup never change. Keep in mind. Okay? The genetic makeup of the person remains same throughout his life, which he has inherited at the time of conception. Out of all genes available to men, some are expressed or some are not, repressed. We have the theory of the genes, Mendelian theory. The expressed gene determine not only his physical makeup, but also what disease is prone to develop and also his nature and intellect. Right now scientists have not reached that why this person is behaving like this, why this person is being, because it is all engrafted from the genes. We have a lot of copy of the genes. Up till now, 23,000 of genes are decoded. But we have more than 70,000 of genes in our human body and which cannot be decoded. And this represents certain natural traits, certain tendencies. So this is what we have to understand. That so the certain genes which is expressed, it can develop a physical makeup. So what the physical makeup the person said that since बचपन से ये पतला ही है, मोटा कभी हुआ ही नहीं है. That means his genes is not going towards fatty means. His genes remain lean and thin only. Okay, so that is what we have to understand. In short, they determine the constitutions of the person. So what we are taking as a prospective totality to arrive the synonym is nothing but the totality of the expressed and dominant genes in that individual. What we are taking the expressed and dominant genes in that individuals. And what Dr. Praful Vijayakar says that it is termed as genetic constitutional semilumen. Because genes represent constitutions and we are taking that as a genetic level. So this is what Sir has coined, that genetic constitutional semilumen. So again, we will go deeper into the innate characteristic is those quality of the persons which don't leave the persons with the change in the circumstances. अगर circumstances change हो गए और वो change हो जाता है, then that it is not the innate characteristic. The feature determined the genes always resist the change. Very important. Genetic in the main always resist the change. Okay, they can adapt the situations, but they resist the change. And when they cannot resist the change, it is called as genetic mutations. So you can find it is in the cancer or it is into the autoimmunity. So in that case, you don't need to prescribe genetic, constitutional, semi-immune. You have to target the body first. When the body is become stable, then and then you have to strengthen the gene. What sir has said in the what Dr. Jitesh Socially has said in the decoding of the cancer series, that when you have to treat the parasite, so you have to treat first, remove the parasite from the tree, and then you have to strengthen the tree by giving nutrition. So same way, when you are treating the change in the genetics, that means the genetic mutations. So in that case, you need not prescribe genetic constitutional semi. This is the note. Okay. So for example, the feature determines the genes always resist such change. For example, timid persons will remain always timid. Okay. Throughout, with the many witness few occasional incidents which he, if he seen as a face value, may appear to be of some courage. So that doesn't mean कि एक बार courage किया तो उसकी timidity चली गई. Timidity remain timidity. Okay. Or sometimes courage because of someone has given support to them. So that is what you have to go through the history. A person is not conscientious if he remains so when all things are going for him. Same I said that conscientiousness has to be tried and tested when situation has been there. If the situation going well, conscientious cannot be tried and tested. So most of the time the children who come into acute, that they say is that yesterday I had children came to my clinic that in spite of having a pain in abdomen, she was so angry on that and she has not expressed the anger in the mothers. In spite of having a pain since 1 week, she used to go to the school, and that is what the diligence, that is the conscientiousness. On examination found to be the report that is a bowel loop inflamed, and that is the colitis. So anger suppressed colitis and diligence. The remedy came to be statistically. I prescribed statistically to her. Previously I had prescribed colosynthesis because of anger indignation, but it did not. It worked for the few days, but still pain remains. But I found that diligence is there. Still pain. She went to the school. So that is what very important aspect of understanding. That is the innate characteristic. So that has to be taken into consideration. These are the things which will not change overnight. See, it cannot change overnight. Anything which change overnight is the active disposition, the change disposition. But the innate characteristic will not change overnight. It can change over years, and then they adapt to certain situations. So that is what something. These are subjected to change only when there is a major causative factor. Okay? So there is the cause. So in that case, what we have to do, we have to focus on the cause. What cause has changed that thing? You know? So what is the causative factor will be such as analog to his or her constitution. Now we have to understand. See, here we have things that the cause. The major cause is affecting the persons, but the causative factor is also analog to his or her constitution. If a person is sensitive to certain circumstances, then and then they are affected. Otherwise not. So otherwise that cause will not affect her. Are you getting me? So example I am giving you, only those people who are sensitive to grief will be found in the element from grief rubric. Are you getting me? So all the grief, element from grief is the people prone to be affected by the grief. Element from vaccination, the constitutions which are easily prone to affected by the vaccination, that are came into that. Otherwise not. You know. So same thing you have to find, that there is a grief. If it is sensitive to that, then it is a grief. Okay. So most of people goes into anxiety, anticipation or anxiety. So people who become very anxious before any engagement. आज ओपनिंग में जाना है टेंशन, आज बर्थडे में जाना है टेंशन, आज एंगेजमेंट में जाना है टेंशन, कैसे जाएंगे, बारिश आ रही है, वो है. So this is something that they are very anxious, anticipation kind of personality. Unless and until they are sensitive. So causative factor is analogous to his or her constitutions only. Okay. First lesson which we learned that is take a big rubric, and the next step is the innate characteristics. Now what was the second lesson? So what was the second lesson is the repertorizing a case is to select the rubric which runs through and throughout that person, which has not changed over the years, or that which resists the change. It is called the genetic or innate characteristic of the person. The first lesson is to take a bigger rubric of the situations, or second is a genetic characteristic. So this will give you a wonderful repertorization's totality, and that you cannot miss the constitutions out of it. Okay, and this must be from the non-disease group of rubric. Are you getting me? So let's study some example. So this is just a theoretical part of understanding how to study the repertory. But now we have certain examples or certain exercise we will do. So first and foremost, sir always says, I do not see, but mind does not perceive. You know, so most of the time we have to perceive something, and then our eye can see that things which is happening in front of us. Okay. So very difficult aspect to learn the things is the mind. The mind cannot be seen. It can be only perceived, or it can be observed from the observations. So this is what we are going to have. So just observe and find rubric. So let's say we have some clips, and out of clips you have to exercise your mind. And then most of the time one video I am presenting you is always we have discussed in the group. But out of that, which rubric we have to take? You know, very important aspect. And we have to differentiate the differentiation of the rubric and its meaning. And that is what we are understanding in the real sense. Okay. So this was the boy in the school. He is studying and he has some expression on the face, and just observe that things, and after that observation we will have little discussion. Most of you have given the answer in the our WhatsApp chat, but I have put that WhatsApp chat into also that, but we have to understand in a deeper way. See what we have exercised in the previous two cases. What we have exercised? We have exercised that one homeopath tell this, another homeopath tell this. So these are the doubts. These are the guesswork. Now we have to from guesswork to the conclusions. You know, clarity of mind. So let's observe. Look at this. Let's see what you observe in this case. Yes. This suggests something that this nose suggests something that this is something that. So this is facial expressions, and what could be possibilities? You have to think like this. See, what sir always says that if I am giving you fish, you will eat for 1 day, and if I teach you fishing, you will eat whole life. So this is what the teaching, that if I give you answer by the straight way, this is this, you can understand, okay, fine, you accept it, nothing is going to go into your mind. But when you thought about these things, what is happening? Now let's have a discussion. What do you think of? See, up till now we have understood we have to observe the things, and after observation we have to conclude something. Okay. So from this video, what we have to conclude? Do you wish to see again? Okay. Let's see the same video again. Are you observing what is the situation is there? It's a school or either he is going on the table of eating and he is something that doing like this. Then again what he is doing is the facial gestures and then what he is doing. Yeah. Now look at this. What is this? See, this is the food for thoughts. So one thing you have that this is the anger. There is expression. You know? So this is the anger. So we can think of the angry remedy. A general broad rubric. More than 500, 700 remedies. Okay? Now you have to understand, does this anger is expressive one or not?
Expressive.
Okay. Expressive in terms of what?
Gesture.
Only gestures. Okay? Not the action. You know? So you have to understand that process. Let's see. So most of you have given this rubric. Dr. Brinda has given this rage, fury, children. Again another rubric is weeping, tearful mood, rage, airs from children in. You have seen that. He is crying. Okay? There is a two thing is happening in the. We will see same video again. Dr. Gohel has said that weeping, tearful mood and the sobbing. Though he is weeping with. This is something which we call as sobbing. Okay, right away. Dr. Akash has said that it is a mood, tearful, anger, vexation from. So the facial gesture shows the frustrations, the anger, and again with the tear. Do you see tear? No. Now you have to understand where I got mistakes. Okay? Right? So that was. This is very important. The sobbing is there. But do you see tear? No. That is very important. So Dr. Akash has said this rubric. Now you have to understand where our horizon of understanding has to be improved. Okay? Dr. Rutu said that rage, fury, staring look with. So what was the staring look? This was something is a staring look. You know? Does this is like this? No. Okay. So now you are analyzing yourself. You know, analyzing yourself. Where we have gone wrong. Dr. Raj has said that malicious, vindictive, children. What is that? Very important rubric. The general rubric has taken. We have a children. Yes, children. What was the things that this is what he want to tell you something that I am going to show you. छोड़ेगा नहीं तेरे को. बराबर. That means he has something which is in the mind. Okay. Okay. We can think of. Dr. Drashti has said hatred and revenge. That is very important. He want to take a revenge. Sorry. This is something that I have to take a revenge. You know. Very important. Dr. Anjali says rage, fury and malicious. Now, if we have combined something, we have to understand what was the presentation of that thing. You know. Dr. Bansi says that anger, violent gestures with. Did you see any violence? That was something different. Okay? Rage, fury, weeping with. Now we have to understand rage and fury. What is the rage and fury? Very important. So, did this child have this? You have to self-analyze yourself. Dr. Hamish, he said, weeping, tearful mood, alternating with rage. So, what was that alternating? So, alternating is not the same time. Alternating is something that the one time the mood is like this, another time the mood is like this. And that is alternating. You know, it is not something that it is happening at the same. So alternate means either this or either that. No, and that is very important. So many a time in the case taking the person is very cheerful. In the sudden way the person becomes so weeping. and after sudden way he becomes so severe, then you can take this is something alternative. It cannot be at the same time. Okay, fine. Dr. Aarti, she said that again same weeping alternate with rage, the same the rubric is. So now another Dr. Sejal has said that the mind rage, fury, weeping with the same rubric, revengeful. Yes, we have the person which is revengeful, he want to take a revenge. Okay, again what was the things? Cut, mutilate, slit, desire to. He said like this. So you can think of, this is the food for thought, a different way of version. Okay, fine. Chinese says kill desire to threatening to. That is the threatening, you know. So this is a different way of understanding. Dr. Mayank has said that weeping, tearful, anger, vexation with. Up till this, okay. Then violent quarreling. Does he is violently quarreling?
No.
Even to the extreme malice and rage. So when you have to focus on certain rubric and understanding, you have to focus on the situation. Does he is doing like same? Then this rubric is very important. Up till half rubric, everything is okay. Anger, vexation and weeping, okay. But then, no quarreling to the maliciousness or rage. Okay. So this is what was the Moscas behavior? So much so quarreling to the extreme that his lip become blue. He goes cyanosis. He goes fainting. This is the extreme state of the rage and maliciousness of the Moscas. So did you observe in that child? No. Another rubric, rage, fury, malicious. Okay. Let's have some food for thoughts. What was the rage? So most of you have said the rage. Now we have to understand what is rage and fury. So the Kant has equated rage with fury is a fury, frantic or frenzy. The violent anger accompanied with the furious word, gestures or agitations, anger excited to the fury. So the fury is mostly the violent with furious word. Does he is telling furious word? No. Furious gestures. The gesture is there, but it is not so furious. You know, a frustrated gesture. It's not so furious. Furious means I have to be in a very aggressive way. Agitations, anger. So this is something, rage is beyond the action. So rage has the higher intensity in their words, in their gestures or in their agitations of the expression of the anger. You know, then need to be distinguished from the anger violent. You know, now you have to understand what is anger violent and what is rage and fury. So anger rubric refer to the general more to the feeling, while rage to the behavior. So one has anger, lot of anger. Person cannot express that or show that. That is anger violent. એટલો બધો ગુસ્સો હતો ને that not so. Okay, and rage is something that the behavior has been changed. You know, that is a very different. So anger violent and rage is different. Are you getting me? Whereas while the patient may report he is given to feelings of violent anger, this may not be visible to others as the loss of control implicit the rage. So in the rage, the control has lost. So it is more syphilitic. Now did you find these things? Control has lost in that child. So rage rubric comes into that. Okay, that's great. We have, you said malicious and vindictive. You know, so what is that? Malicious. So malicious is equated with the resentment, narazgi, revengeful, badla lena, vindictive and spiteful, and is distinguished from the hatred, cruelty, mischievous and the moral feeling want of, for which he erected a separate rubric. So these are the difference. Resentment, revengeful, vindictive and spiteful is also different from the hatred, cruelty, mischievous and moral feeling want of. But what is that? So malicious means what? harboring ill will. What is that? The will is ill. You know, harboring ill will or harboring enmity. तेरे से बदला तो मैं लूंगा कभी ना कभी enmity without provocations. Very important aspect is maliciousness. No, there is no provocations. If there is a provocations, then the maliciousness gone. You know? Did you understand? Did you understand what I mean to say? Okay? Disposed to injure others without the cause. अभी कैसे? I'll give you example. The teacher is very strict in the class. Okay? And there are mistakes. You understand? See, very important aspect. So in that you have to understand. When you are spiteful, you have a maliciousness also. Now we have a word hatred. You all have hatred and revenge you have taken. So hatred means great dislike or aversion. Again, enmity. Great enmity. Great aversion. Great dislike. Great abhorrence or detestations. They can't refer that it is from here the comparable Raja rubric malicious, in which with the single exception rest of all remedy or hatred to be found. Now malicious is however distinct in that it is unprovoked disposition, whereas hatred tend to result from a perceived offences or injury done by the fellow man. Are you getting me the difference? Do you get? What is the difference between malicious and hatred? Someone has injured, then they provoke. Someone has provoked, then they react. That is hatred. That is a great enmity. Same way in the maliciousness also desire to injure others with the enmity or ill will to others. Okay? So same, but the difference is there is one thing is unprovoked and one thing is provoked. Are you getting me? So let's again exercise. Find the rubric. Same, but see why I am giving you the food for thought. Now you have to understand from the perspective of the difference. I have given a difference, then your thought process becomes changed. Now what was the rubric? So here something is happening in the classroom. So you have to understand the gravity of the situation. What is the causative factor and what was the resultant effect? You know, every time the reaction comes out of the any cause. So here we don't know the exactly the cause, but we have to understand in the depth that this can be the possibility. This is for the food for thoughts. This is not the real case, but from that understanding, if the person comes to you, you can think like that. Are you getting me? So sensitivity belongs to the constitution and the reaction belongs to the miasm which he prone to. Okay. So according to miasm, the reactions has changed. In a sora, it can be anger. In a psychotic, anger cannot be expressed or anger expressed in a higher way. In a syphilis, the anger goes into out of control. It can be a rage, it can be a fury, it can be a violence, anything else. So this is what the reactions. So we have to understand cause and effect. Now what is the cause and effect in that video? What could be the cause for this? In the school something is happening. So what could be the possibility of the cause?
Scolding.
One thing is scolding. Scolding by teacher. Okay.
Teasing by some colleague.
Just teasing by someone. Okay. Anything else? Or either punished by teacher. You know? So either the child is being scolded by teacher, one thing. See, now your thought has started. You know. Second, either that child being punished by teacher or punished because of some colleague. You know, someone is doing mischief and he got punished. Then the perception is Wrong support. Perception is wrong support, but the reaction is different. You know, that is very important. Either the child being bullied by the colleague or peers, obviously you thought that same thing, what I thought. So what was the reaction? Anger.
But not accept.
But not as expressive as it is violency due to timidity. Weeping. It is also not so expressive due to timidity, so the sobbing. And he feels hurt, so he wanted to take the revenge. Badla lunga with someone who hurt them. So there is a malicious and behavior due to timidity. He wants to harm, but he has not done. So here malicious and vindictiveness is there. So here he would take general rubric. We will take general rubric as a disposition that maliciousness. The mind is in the malicious or vindictiveness. But again, one thing is here the provoking is something. Someone in the classroom has bullied them, or because of them he may be punished or he may be scolded by the teacher. So he wanted to show his hatred towards them. So hatred who offend? Are you getting me? So these are the broad rubric we have to take into consideration, not the particular rubric. Are you getting me? First general rule, broader rubric of the disposition help you to narrow down the remedy. This is food for thought. Clear? I hope this is a very simple understanding of the situation. Let's say another example. Find the possible rubrics for this very cute baby, and let's have a video. What is this?
Fear of
Fear.
own shadow.
So we have the rubric fear of own shadow. So what was the cause and reaction? Now you have to understand everything is the cause and reactions. You know. So the cause and reaction. So here is the child which was affected by her own shadow. Okay. So what was that? The shadow meaning the shade within the clear boundary and unilluminated area. Shadow is something which is in clear boundary. So she shows the boundary. And it is unilluminated. There is no illuminations, but it is a dark. So something is dark. So we can take fear dark of also. Okay. That was thinking. Shadow causes what? Shadow causes anxiety, fear, and what was the reaction? She goes into the panicity. So panic in the child. What was the reactions?
Shrieking, crying,
Anxiety, fear, and panic reaction. These are the reactions. So what was the rubric? Fear, shadow of our own. Now your mind becomes little bit clear from the situations. Are you getting me? Very easy. Let's have another example. Observe this video, and then we have a food for thoughts. And what was this is? The rubric. Let's have some food for thoughts. Mischievous, very good. The
And
mischievous. Okay.
Attention seeking.
Attention seekers. Okay. Anything else?
Doing this for money purpose.
Doing this for money purpose. Okay.
Expression fast in the
Expression changing. Do we have a rubric expression changing? See, we are studying repertory. So we need to find out the rubrics only. Okay. Let's look at the repertory. Do you find expression changing suddenly? That was the rubric. But this is something general.
Talking with gesture.
Talking with gestures. Very good. Perfect. Anything else? Do you wish to see this video again? I hope this video is clear. No need to repeat that. Thought, think, analyze, and tell. Use your logical brain, left brain, to analyze this case, analyze this situation, analyze this video, and then your brain will give you information. What is this?
gestures making talking while.
Gestures making talking while. Very good. Fine. So same way what I am right now representing is gestures making talking while. You will take the same thing for me also. So what is the difference between me and this fellow?
Funny
Funny.
expressions.
Yes. That you have to understand. Very good. The funny things. Very good. Funny. Anything else?
Mischievous.
Mischievous. Very good. Anything?
પેલા માટે expression changeable છે.
Yes. Expression changeable. It has I think 24 or 25 degrees.
એના પેલા cross માં changed appearance.
Appearance change. Okay. Fine. It was in the face expression changeable. That was the rubric like in the face chapter, not in the mind chapter.
Amusement, desire for occupation.
Yes, very good. Amusement, desire, occupations. Then, what was the rubric? Remedy is there in that rubric. Jesting. Okay. Jesting. What was the meaning of jest? Jest means to joke. So in the joke, the verbal communication has been gone. Or the verbal communication is there. And in that, you can use your logical brain to laugh. You know? So in that, he had used any verbs.
Attracts others towards himself.
Okay. What was that remedy in that rubric? Attracts others to himself. So
Like
that could be the attention seekers. We can generalize it as a attention seekers. You say, right? Anything else? So let's have see. So here the cause and reactions. See, everywhere when there is some reaction, you have to understand the cause. What was the cause behind that, and what was the reaction? So what is that? Here in this video, this person is a street artist. You know, he is an artist. So their sole business is to earn something. So to earn something, I have to give something. So what was he doing? So his main intention is to entertain the others. The intention is something that you want to entertain. Okay? So not doing any harmful activity. But he do mischief to please and making fun and joy to others by doing weird behavior and act and gestures. Are you getting me? See, we have to analyze this way. If you have to try to analyze in this proper way, then your remedy or rubrics comes very, very peculiar. Okay. Now, so what was the reaction? See, this was the cause. So from there we have to find out the reaction. What was that reaction? You understand? This is a street artist. You want to entertain the person or entertain the people. So for the entertainment, he is not doing any harmful activity. One thing. So he is mischievous, but he is not mischievous to the teasing level, or he is not mischievous to the malicious level. Are you getting me? And then what he is do? He try to please by making fun and joy and doing weird behavior. Okay? And act and gestures. So what could be the rubric? Reaction. You rightly said it is antics play. So what was the antics play? A ludicrous or grotesque act done for the fun and amusement. Are you getting me? The ludicrous means laughable, joyable, enjoyable. Grotesque means the changing the faces or changing the weird things or changing the shapes. The grotesque meaning is like this. So what he is? He is an adult, but what he has changed? He has changed to the small kid. Grotesque. Okay? Act done for the fun and amusement. Gestures make ridiculous. Now this was a cross reference. Here the rubric is the only first rubric is correct for that. But we have to learn the rubric in this way. Now what is the ridiculous? So in the ridiculous means a laughable. Someone is laughing. But what is that? In the ridiculous, the intention is different. You know, ridiculous means to ridicule on someone else. So the intention is different. Here the intention is different. Okay, but it is something that laughable. So the person is doing mischief in a ridiculous way to harm someone else, or their intention is harming others, and rest of people will laugh. That is just ridiculous. So in that what? Language or behavior intended to mock. So they are trying to mock. Now mocking is a different version. You know, mock or humiliate. So in front of they are humiliate. Did you observe that video of sarcasm? When I have taught you the sarcasm, that one fellow is giving a joke that he said that इतिहास की जानकारी नहीं रखता है, रामचंद्र जी ने हिरण मारा था तो कितने पापड़ बेलने पड़े. Salman Khan वाला वीडियो है. That was the video. So in that also he tried to mock and humiliate. So this is something that ridiculous. We laugh, but he is just making a ridiculous things. Okay? So this is a negative way. You know, the first rubric is the positive way, the making fun and enjoyment. Gestures make strange attitude and positions. Are you getting me? So it can be one thing is strange. So being definitely out of the ordinary and unexpected, slightly odd or even a bit weird. So the gesture is like this. The position is like this. The attitude is like this. Okay? So you can think of. But here there is no intention of the fun and amusement. So we have to take again this rubric. Okay? Grimaces. What is the grimaces? The facial expression has been changed. That is the grimaces. You know, pout kare, kare. These are the grimaces. Most of the time the selfie lovers are doing like this. Okay? And Snapchat. We have Snapchat. In Snapchat they make us some different faces. Contorted, distorted facial expression. So that is called a grimaces. So we have observed this is a grimaces on the face. You know. Now why grimaces come? This type of grimaces comes out of some frustration, some anger. So here the sora is not fun. So again we have the first rubric. But this is what I am going to differentiate from the just observation. Are you getting me? Childish behavior, very important. So the man is behaving like a child. That was the childish behavior. What is that childish behavior? For the fun. But here the understanding is adult behavior. Where you have to take the childish behavior? The adult behavior indicating a lack of maturity. So according to their age, the maturity has gone. And that is the childish behavior. So childish behavior is a very broad rubric. So when persons, an adult, cannot understand the gravity of the situation and behave like a child, is a childish behavior due to lack of maturity. And the child who becomes so mature and behaving like the adult, it is called precocity. So here are the two apart poles, precocity and childish behavior. Are you getting me? Foolish behavior. See, every behavior represents something. So why I have given a meaning also? Because this meaning will give you a food. That if we found these things, then this is the rubric. If we found this thing, and this is the rubric. So here foolish behavior. So devoid of the good sense or a judgment, having or revealing stupidity. So here foolish behavior is because of no intellect. So here a dullness of the mind. Whereas in antics play he needs more mind. Are you getting me? To make a fun for other, he used to take intelligence, quickness. One patient, that means someone has given a money, he used to clap. So someone coming to, they have to make the fun. So this is what a quickness. So here the intelligence is used. Here the intelligence is gone. Are you getting me? So out of this, the first rubric is for that case, that videos. Okay, but we have to differentiate these things, and that is very important. So where to take ridiculous, where to take strange, where to take grimaces, where to take childish behavior, where to take the foolish behavior. This is what we have to put for thought. Let's have another video for exercise. So look at this thing. फादर ने बोला कि बच्चा दिखाओ.
Lan oğlum düştün lan. İn bakayım şimdi. Aferin lan sana. Çık bakayım bir daha. Yok yok bakma. Çık oğlum çık. Canavar be. Bak şimdi bana. El salla. Sallama şaka yaptım. İn aşağıya. Düşersin el sallarsan. Hadi aferin sana fırlamayı. Eşeğsiz.
What is this?
Imitating. Fearless.
Fearless. Okay. One thing we can think of fearless, courageous.
Imitating.
Okay. Imitating what?
Monkey.
Imitating monkey. Oh, yes, very good. Imitating monkey. That's great. But do we have a rubric imitating monkey?
Imitating.
We have a rubric behavior monkey-like, but not the imitating monkey. Okay. It is also antique play.
Appreciation.
Okay.
Appreciation.
Father domination.
Father dominations. The situation. We have to understand cause and relations or cause and reaction. Okay,
Want of appreciation.
Want of appreciation. So that was a need for that food, that child. Very good. Then, but what was that reactions? See, we have to prescribe on the basis of reactions. You know, we have to find the reaction which is syphilitic. So reaction belongs to the miasm. Sensitivity belongs to the soras, constitutions. So that sora is wanting appreciation. You know, but what the reaction is? It's normal. How many? I think it was 5 years old kid. Okay, how many 5 years old kid climb this without any things? Does this is normal behavior? So what is this? You have to observe that this missed. Then it is precocity. In that what you can find beyond the time? Nothing. How many adults can climb? No beyond the time. You know, this is what something we have to understand. What is that? What is that? Are you getting me? What it is? So again, what sir says, I do not see what mind does not perceive. So something is not in your mind, it cannot come out. So the cause and reactions. So father asks child to do this because some guest is coming at home to show that. So child doing something which is not normal to anyone of his age. We have to analyze in this way. It is something unique quality. Did you? In this, he tried doing due to getting attention and appreciation. That is what the Sora we have to find out. Okay, getting attention and appreciation. एक बार गया, उतर गया, वापिस बोला पापा चलो ऊपर चल, तो वापिस आ गया. That means he wants to get appreciation or attention. So what was the reaction? Now that the reaction is the rubric. What is that? This is the strange, crank in acts and opinion. Now what is strange? Previous slide we have taken this, but still you are not in the mind. So that is what strange, being definitely out of ordinary. Out of ordinary are unique things and unexpected. You cannot expect this thing from the child. Slightly odd or even a bit weird. Now you have to clear in your mind that this is something strange. No. Strange in acts. Here two things. Acts and opinion. So opinion is some verbal command to the particular situations. Some people may be very weird in situations also and giving opinion to the situations also. Then also you can take this rubric. And in actions, action means the act, they are performing something, in that also. So what he is performing? Performing to climb without ladder. This is act. So this is the perfect syphilitic rubric for that child. And the remedy is sulfur. What was the soda of sulfur? Getting attention and appreciation. And strange and cranks in acts and opinion. The remedy is sulfur. Are you getting me? Very, very extroverted kind of personality. I had taught you sulfur in the Materia Medica series. So you can go through that video. You can have this rubric also. Are you getting me? Let's have another exercise. So this is a movie clip, an old movie. So you know this actors is Raj Kapoor.
ऐसे घूरते क्यों बच्ची? मेरे मन में एक बात आई है। शिव जी की कृपा हुई तो एक दिन फूल सर का एक छोटा सा लल्ला होगा मेरा कम्मो जी, और उसका नाम मैं रखूंगा श्री गंगा प्रसाद। कम्मो जी, आप मेरे उस लल्ले की मां बनेगी। आप एक ही लल्ले की बात सुनकर फिक्र में मत पड़िए कम्मो जी। अगर छिपली ने चाहा तो यह लल्लों की लाइन लग जाएगी जी।
Let's have a fun. Now look at this and tell me the rubric. That's the fun of repertory. So why I am making fun? Repertory is the study of fun. Lot of fun with the repertory. So this is the fun. Now tell me, what was the rubric for this? Expressions. Very good. Name. Yes. Yes. So indirectly ki do hai, okay, fine. The way of something is something different. Yes. Restlessness. Postures ma. I don't see any restlessness in postures. Anything else? See the facial expressions.
Shyness.
Shyness, very important. The shyness. So shyness is a hesitancy. Okay, anything else? Do you wish to look at? So once again look at this clip and let's have fun of learning repertory. Look at this.
ऐसे घूरते क्यों हैं जी? मेरे मन में एक बात आई। शिव जी की कृपा हुई तो एक दिन फूल सरी का एक छोटा सा लल्ला होगा मेरा कमल जी, और उसका नाम मैं रखूंगा श्री गंगा प्रसाद। कमल जी, आप मेरे उस लल्ले की मां बनेगी।
Now look at this. The expression of that lady is different. Look at
आप
it.
एक ही लल्ले की बात सुनकर फिक्र में मत पड़िए कमल जी, अगर छिपने ने चाहा तो यहाँ लल्लों की लाइन लग जाएगी जी।
See the facial expression of these good actors, older actors. Now, tell me the rubrics.
Fear asking what he wants.
Fear asking what he wants. Okay, that was not the thing. Okay, well, let's have the food for thoughts. Fear asking what he wants. So, if in that case, what is the expression of the person?
Hesitancy.
Hesitancy of asking he wants.
Directly.
Okay, but here he is telling something in a different way. Yes, flirtatious. Yeah, you can say the flirtatious. Knave, very good. Knave. Anything? Let's the cause and reaction. So here in this video, he tried to tell something to that girl. What is the purpose to tell? Purpose to propose that girl. See, what was that purpose? To propose that girl in a different and unique way, with very simple Simon type behavior. You know, very simple. Not see, gulab deke, I love you. Will you be my Valentine? Not like that. But it is something simple Simon way. Okay? So he used his logical brain, you know, to express something. He used his brain, na? So he used logical brain to express his feeling. You know, feeling is from right brain, but he used left brain. And it's a very simple but very impactful way. See, very impactful way. So what could be the possibilities? Now the rubric. This is our exercise. So what could be the rubric? New, but very intelligent. You know, this is the rubric. New, but very intelligent. Now what is new? New is marked by or showing unaffected simplicity and lack of guile or worldly experience. You know, something that there is no corruptness in the mind. He said very plainly कि in the future ईश्वर ने चाहा, शिव जी ने चाहा, तो we will have a, I have a child. Okay, so that lady was shocked or surprised. You know, the expression on the face was one is surprise as well as shock also. You know, fine. But what is that? He says very intelligently. So this is what knave, but simplicity, very simple, simple. The face is like this. Intelligent. The intelligent is having a capacity for thoughts and reason, especially to the high degree. Do you think like that? How many young boys are wanting to purpose like this way? No. No. So this is what high degree of reasoning, high degree of thought, high degree of intelligence. So here the rubric is very clear that the person is very new and intelligent. The remedy is hypocymus. You know, very, very shy, bashful personality, but very naive and very intelligent. You know, and then what he incite? You know, Alzheimer's has a capacity to incite others. What in the second line he incite? एक से घबराना मत, लाइन लग जाएगी. अगर शिवजी ने चाहा, शिवजी means what? I. That is what he is wanting to propose. Shivaji means I. Then it has a line of children. You know, this is what something that. So this is a higher sentence. Are you getting me? Hope you understand in a very better way. Let's have one thing. Look at this, the fellow. Consider this is a fellow, and he is in a queue of a ticket. So look at the video, and then we will have a rubric. I think this was the last video of this session. That's he came, you see. Tell me the constitutions and its the behavior pattern and its gestures, act or something that you have to observe from the video. What was that?
Confused.
Restlessness and calculating.
Yes?
Restlessness.
Restlessness,
Confusion.
confusion,
Indecisive.
indecisiveness, hurriedness. Okay. Anything else? See what he ended up at. Nothing. So what is that? See everything. If you have a clear definitions of the word, then your rubric is very precise. If you don't have clear-cut definition of that word, your rubric is not precise. Okay. What was that?
Fruitless.
Fruitless. Okay. Activity fruitless. Okay. But he is here to take the tickets. It's not the activity fruitless. Okay. That's the food for thought. That's we have to read. Cause and reaction. Here that person's in a queue to take a ticket. Okay. So reactions. What could be the possible reactions? First, he used to get ticket where he gets it with the ease. He tried that easily where I get the ticket. So he goes there, he goes there. Okay. He might be impatient. He might be impatient. He is not taking any decisive actions. Sometime here, sometime there. बीच में वो खड़ा रह जाता है. He may have been in a state of confused. So what could be the rubric? So rubric is indecisive irresolution. So what is the meaning of indecisive irresolutions? The doubt concerning two or more possible alternatives or courses of action. Now it is very clear definition. Doubt concerning two or more possible alternatives or courses of actions. इधर जाऊंगा तो फटाफट मिल जाएगी कि इधर जाऊंगा तो फटाफट मिल जाएगी. कहाँ जाओ, इधर जाओ, इधर जाओ, इधर जाओ, इधर जाओ. So in that course of action, he is not taking any decision out of it. So the perfect rubric is this. Are you getting me? Most of time we loosely take this rubric कि person decision नहीं ले पाता है, तो that means we taking decision. But this is something you have to understand this in the proper sense. Doubt concerning two or more possible alternatives. If there is a alternatives, then I cannot decide what should I do. See, for example, a lady went to a shop, sari shop, and they have to choose the sari. And they goes to the shopkeeper, and the shopkeeper shows lot of varieties of, and then finally bring 5, 6, 7 saris out of that. And then she started, do I take this one or do I take this one? Do I take this one? Which one is good? I cannot take a proper sense of decisions that do I take this or not, that. And that is exactly the indecision. You know, so concerning two or more possible alternatives, if there is no alternative, then there is no decisiveness. You know, so if there is an alternative, बच्चे को बोला है क्या खाना है, मम्मी बोलती है ये है ये है ये है वो है, ये खाओ कि नहीं खाओ. Do you get it? So this is something that they have to decide on the basis of that point of view. Are you getting me? So when there is a two or more possible alternatives or course of action, there is a doubt, then it is indecisive irresolutions. Clear?
Yes.
So indecisive irresolutions. So what are the cross reference of this? You know, we have a lot of cross reference. So cross references, one is doubtful. What is doubtful? A full of doubt or a suspicious. The state of being unsure of something. Suspicion means the state of being unsure of something. Clear? One is doubtful. Second one is idea, instability of unsettled state of mind. There is an idea, but not stability. Unstable, unsettled state of mind. This or this. I have this idea, I have to do this or this. This is something. Impressionable, susceptible. What is the impressionable, susceptible? Easily impressed or influenced by something, that is impressionable, susceptible. That's why they cannot take decisions, indecisive or irresolution. So inconstancy. I am not constant in anything. The quality of being changeable or variable. Sudden change. So this is, they never remain constant to one particular thing. Inconstancy. Okay. So same, mood, changeable, variable in opinion. Suddenly change है. अभी तो बोला था ये करना है, बाद में नहीं, मैंने कहाँ बोला नहीं. Mood changeable. That was the changeability, variable in opinion also. Confusion. So what is the meaning of confusion? Lack of clarity. If there is a clarity, there is no confusion. Thought, two train of thoughts. इधर जाओ इधर जाओ, इधर जाओ इधर जाओ. But it is in the thought only, not in the action. So here it is in the action. So when there is a thought, it is something different. When there is an action, it is something different. So thoughts is that two trains of thoughts. Okay. Then there is a wish. I need to do this or I need to do this. I cannot understand. Then the rubric is will, contradictions of, or will, to, will, he has. I have to do this or not. Okay. Will, contradiction of, or antagonism with self. So in will contradictions is the thought process, a thinking process. Whereas antagonism with self means it is in the action part, a deeper version. Are you getting me? So this is something. So these are the food for today's, and I am giving you some rubrics for the learning, that if you found some inferiority complex personality, what could be the possible rubric? If person feels inferiority complex in himself, what could be the possible rubric? Let's say
lack of confidence.
Lack of confidence.
lack of confidence, exactly the perfect one. Second,
Confusion of mind.
Confidence want of self, confusion,
Confusion of mind.
contemptuous of self, not confusion, delusion smaller, yes, reproaches himself, the action part. Timid, bashful, appearing in public, delusion diminish, delusion smaller, delusion dirty he is,
Delusion poor.
delusion poor, poor in terms of the things, not in terms of inferiority complex. Delusion failure or he will fail, or undertake nothing lest he fail. मतलब मुझे ऐसा कुछ काम करना ही नहीं है जिससे मैं फेलियर हूँ. So these are the few rubrics of inferiority complex. Why I am giving you this is the food for thought. You have to differentiate one by one. Okay. Rubric for people who are rude, harsh toward others. Tell me, what was the rubric for the rude and harsh people towards others?
Hard to inferior.
One is haughty, yes.
Hard to inferior, soft to superior.
Okay. Hard to inferior, soft to superior. Okay. Anything else? Hard-hearted. Very good. Hard-hearted. And so first and foremost is contemptuous. You want to contempt. Okay. Second, rudeness general. He is rude to others also. Insolence. The behavior is very insolent. Abrupt and harsh. Cursing and swearing. Hard to or harsh to others. मेरी सास ऐसी ऐसी गालियाँ देती है ना कि तेरा ये हो जाए, तेरा वो हो जाए, तू ऐसे जन्म में तेरे को हेल मिले, वैसे वैसे इतना कर्स करती है. That was harsh cursing. Abusive, insulting. Impertinence, insolence. These are the one single rubric. So these are few rubrics you have to understand in the persons who are very rude and harsh towards. Okay. The rubric for representing lively or social people. So what was the lively and social people?
Extroverted.
Highly extroverted. So what was their behavior pattern and what was the rubric we can think of?
Vivacious.
Vivacious. Perfect. You are a genius. The first things vivacious. They are very social. Sociability. They are very exuberant. Exhilarations. Company desire for. Absolutely right. Loquacity, mirth, hilarity, what we are doing right now, and the cheerfulness. So these are the few rubrics for the lively and social people. We will continue this journey. Goodbye. Until next time, we will have the food for thoughts to learn the repertory with the fun way. That is what my aim, and this aim is to share the experience and learn the repertory in a very easy and funniest way, and you remember very easily. That's what I am sharing with you. Thank you all, and thank you all online learners for the wonderful journey. This journey will continue again and again. Thank you.